This is not drinking water which is being delivered to our houses. So you just don't have to go to a lab to quantify the contaminants in that water. You can see that the water is not clean. But for some people, this water is still drinking water. Around 2.2 million people across the world, they die every year. This has to be addressed on urgent basis. ये इस वक्त सबसे बड़ा मसला है, climate change, environmental problems, but nobody, like governments की priority नहीं है.
Hello and welcome to another installment of Front Seat to Climate Change. We've been discussing the fact that climate change is going to impact the very fundamental right to life. And over the past couple of days, we've had discussions with experts and lawyers talking about how that impact actually comes to food. At the same time, we've had certain technical discussions, and our today's episode will be on water quality. Water, again, is a very basic necessity of life, but the quality of water in our homes, in our offices, even in our public buildings such as mosques, universities, all of it is very important to our health. To talk about it, we have Dr. Nausheen Zaidi with us, and she's been working over the past couple of months, I think nearly a year now, taking different water samples from different localities all around Lahore. And her work has begun to show us that what we assume to be very safe drinking water for use on a daily basis is not as such. So to start off, Dr. Nausheen, welcome to the show.
Thank you.
We've had guests, and something that they keep on pointing out is that our condition, rather than becoming, the welfare state has to provide welfare, and over time we assume that the quality of life improves. But in my experience, in their experience, a lot of anecdotes from all around the country, even other places in the world, the quality of life, certainly in the developing world, has not improved, or the promises that were made on behalf of the development agenda of the world has not come. So what do we really think in terms of how do we improve our lives when state capacity, whatever we consume from all around our politicians, international development agenda, how can we really say that the citizens' life will improve, and what in your experience have you seen over the past couple of decades happen to the cities you've lived in? What can we begin doing that we can improve that quality of life?
What I have seen in my lifetime, that when I was a kid, we were consuming the water that was delivered through the pipelines in our houses. So we were just boiling the water or just straining it. The concept of bottled water, it emerged in the mid-90s or late 90s, I would say. And things have changed in such way that now whenever we talk about drinking water, what comes to our minds is bottled water. And I'm just talking about certain class of people who can afford that. And it is, I teach in a public sector university, so those students who are coming to my lab are from middle income to lower income families. And when I started working on in this one water project, and I said that the water that is being delivered to the houses in Lahore, it's not clean, because we had some evidence in the beginning. So mostly people think that this is not the water that we drink. That's what, like, most of the people, even from the middle income families, they think that this is not drinking water which is being delivered to our houses. So it is like we think that this is to drink we need bottled water. This is one thing. And because these kids, they are like science students, so we have to, they need to understand. And I always tell them that, see, that when we say the term drinking water, it doesn't necessarily mean the water that we drink, because if you look at the WHO's guidelines, they clearly say that drinking water quality should be maintained for all domestic purposes. It includes water for drinking, food preparation, and for personal hygiene as well. So what I have seen, like you asked me that how I saw the changes that were happening. This is like one change that happened, that we cannot even consume the water that is being supplied to our homes through the main water boards across the country, I would say.
And there's also, I think, there's a fact of trust in this, that You mentioned boiled water. So
Yeah.
when I was a kid, I used to see my grandmother have those huge dechkas
Yeah.
and put on the stove और boil हो गया तो consume कर लिया. उसी से हम ठंडा होता था बोतलें भर लेते थे and then used to consume throughout the day. लेकिन अब if anyone suggests that, that sort of even posh localities who might have those filtered connections at home, those 3 filters that UV rays and the one for the solids. Even after that, you wouldn't say boil के बाद ही consume कर लो. People will still say कि हमने पानी लगवाना है, वो commodification वाला angle आ गया है. So I think that's very noticeable that people have lost trust in the state's ability to provide that clean water.
Exactly.
So it's also maybe that people are not just have this paranoia, but there is this disinterest by the state that they no longer want the people to be actually using that, what they're fine with commodification as well. So does that commodification, of course, I think it further then weakens the whole idea, it creates a cycle.
Of course
So,
it does.
what happens, I'm just talking about people like us who can afford it, but then there's a huge chunk
Exactly,
of urban
exactly.
population which can't afford energy and water. You worked with them, those communities. How do they deal with this whole dynamic?
So, okay, so I have been working in different areas. So even if you go to different low-income areas, the situation is not same, across the city.
Yeah.
So there is one area which is Chungi Amar Sidhu. If you go there, some families, they can afford to buy water. They can. Some of them can still afford to go to the filtration plant because they have like some way of commuting to the filtration plants, and that plant is not that far away, and they can still do that. But there are other areas like Shadipura or Sharifpura. People living there, they cannot even afford to go to the filtration plant because it's very far from their houses. They cannot, they don't have means to do that, and mostly in all of these communities, mostly it is women's responsibility, the water, because they're stay-at-home mothers, they are staying with their children, and they have to provide water. So sometimes it is not easier for them to go and get water from the filtration plant. So they are forced to use this water at least for some of the domestic purposes. Maybe for drinking, in Chungi Amar Sidhu, people get drinking water from the filtration plants. It is not very close, but still, it's not that far either. So they get the water from there. Lekin Sharifpura mein, people are using this water for everything. They know that the water is dirty. They can see that. So you just don't have to go to a lab to quantify the contaminants in that water. You can see that the water is not clean. It is not aesthetically, all the aesthetic parameters are also not met with this water. It smells bad. The color is like brownish, but still they are using this water. So when people say that it is not drinking, it is very class based. So the people who can afford bottled water, they think that for them drinking water is separate from the water that they are using for hygiene or for other purposes. But for some people, this water is still drinking water. So I think it depends where you're coming from, where you're living.
Okay. And in your work, you've collected more than 100, nearly 200 samples.
We have collected more than 1,000 samples now.
Yeah.
So it's like a large number of
I'm
samples.
sure sampling itself is a very technical method that goes into it. And there must be certain standards that have to be maintained throughout any municipal locality.
Yeah.
So what are those for in our dynamics locally, and what are the best practices internationally?
There are, when you talk about quality of water, there are different aspects. So you can, there are different kind of contaminants. There are microbiological contaminants and also chemical contaminants. And of course, both kind of contaminations have different kind of adverse effects on human health. But when we talk about waterborne diseases, what we are mainly focusing on the diseases that are caused by microbiological contamination. So around, I think from last year, the stats I was looking at WHO's report, and it says that around 2.2 million people across the world, they die every year of simple hygiene-based diseases like diarrhea. And most of these people are, of course, children from developing world. So when we talk about microbiological contamination, its effect is immediate and urgent. So if there is that kind of contamination in water, it is something that should be addressed immediately, and it should be prioritized, even according to the guidelines provided by WHO. The impact of chemical constituents, people often talk about arsenic contamination or lead contamination. I'm not trying to downplay the impact of heavy metals on human health. Of course, they are they're very important, and they should be, especially in terms of Lahore. We have found certain areas where the lead contamination is very high in the domestic water supply. This is this has to be addressed on urgent basis, and it has very adverse health impacts, and we have also collected the data on health parameters. But that problem is, it takes some time for these health problems to occur or to develop. But the impacts of microbial contamination are immediate. So they have, and they could be comparatively, they are easier to address, at least in certain cases. Maybe not in our case if the situation is really worse. But in certain cases, there are ways of treating water. There are other things that could be implemented, and they're comparatively easier. So when we talk about the quality of water, of course, all of these different kind of contaminations are important, but in terms of Pakistan and in Lahore, what we have studied, that the problem of microbiological contamination is very widespread. For the heavy metal contamination, this contamination is present in the areas which are close, like residential areas which are close to industrial zones of Lahore. But microbial contamination is, the spread of that kind of contamination is wider. That's what I think.
And I was having a discussion about the river Ravi as well, and Ravi has been pointed out as the most polluted river in the world. That particular report was actually looking at pharmaceutical waste, some of those chemicals along with the metals you mentioned. They sort of commented that the river is polluted, but our water, thankfully, does not depend on the river, and we use a lot of groundwater. So based on your samples, we sort of have to, go to the conclusion that groundwater no longer is as safe, or as soon as it comes to the surface, we have not been treating it effectively, or it does not go through that method. So is it safe to assume that the groundwater itself is polluted?
With the circumstantial evidence that I have, I think that groundwater is cleaner, because in a few areas, like there is an area called Kirianwala in Lahore, we found that it was like the Wasa supply there in that area, Wasa, like whatever water board is working in that area, the water supply was not clean, and it had E. coli in water. But most of, like 95% of the population living in that area, they started using boring water. So they have like this bore system. And now the water they are getting, for now it's clean, for the samples that we have checked there. So it means that the groundwater is still, it is at least not contaminated with microbiological contaminants. I'm not talking about any, because I haven't checked for other parameters. So, but in that case, it is clean, it's coming. So that's why we think that this contamination is happening in the pipelines. So when we talk about water safety, there always a multiple barrier solution to it. The first thing is that we have to keep the water source or the resource clean. The second one is the application of the proper treatment method, whatever it is. In most cases here it is, they add chlorine to water to kill microorganisms. And the third one is management of this water which has been treated, so that it is supplied to the consumer end in a clean way, right? It is still clean when it is supplied there. What I think, or what I have observed, that till the treatment, the water is fine, but when the water is supplied or distributed to the consumers, it is contaminated. It means that our pipelines have some kind of leakage or seepage. I don't have the maps of these pipelines.
Pakistan is one of the countries with very high infant mortality,
Huh.
and at least at the Punjab government level or federal government level, there is a recognition that infant mortality and your childhood stunting and your
Exactly.
wasting, a lot of it happens because the mother herself got impacted by poor hygiene, or the clean water was simply not available. And we're talking about Lahore, but most of South Punjab, for example, the 11 districts, they have one of the highest infant mortality in the country. Not just compared to other even provinces, it's far worse. So, what could be something at the personal level? Are there any other than I've seen examples where people have had to put those small capsules in their water tanks to clean them up, especially when this panic about the brain eating amoeba happened. There was this sudden market demand for those cleaning capsules. But any from a low income community, what would be the right methods if they know that the water is unclean? What should be they doing? Is the simply boiling? Does simply boiling help, or are there other methods that can further make it more better in quality?
So this is also a problem, because that's why we are organizing these workshops that are tailored according to the needs of any specific area, because we find different kind of contaminations in different areas. Bacterial contamination के लिए, of course, boiling water एक मेथड होता है, that this is also recommended by WHO, और उसके कि ड्यूरेशन इतना हो, अलग बैक्टीरिया के लिए अलग टाइम और टेम्परेचर recommend किया जाता है. So boiling water is beneficial against if there are bacteria in water, right? But in the areas like Sharifpura, where there is lead contamination, if they boil the water, the concentration of lead will rise. So we cannot recommend them to boil water. Unke liye filtration plants is like the first step is filtration plants. वैसे तो जितनी severe वहाँ के ऊपर contamination है and the problems that are there in that area, उसके को long term solutions की भी ज़रूरत है. मगर जो short term immediate जो चीज़ है, it is installation of filtration plants, a lot of filtration plants in that area, so that the people could actually have clean water at least कुछ अरसे के लिए, जब तक कोई और solution नहीं होता. Or of course the factories that are there, they have to be regulated, and these factories are not big factories or anything, they are small foundries. The people running those factories are also poor people, they don't have that much money. तो ये जो regulations हैं, they have to be implemented, laws तो मौजूद हैं, तो उनकी implementation जो है, that is very important I think. So it depends कि contamination किस type की है, उसी के हिसाब से आप solution बता सकते हैं लोगों को.
In terms of water authorities, right to access to information, should it not be something that I remember when the air quality issues happened, they were not giving air quality reports, and the court ordered them that you should be putting out reports every day. So perhaps the courts could intervene, even though it's not something that go to the courts and start complaining or telling on them, but that's the one option that you're left with, that the right to access to information, either the RTI Commission does something about it. If they don't, then of course you have the courts. Should it not be that water quality itself is being published from various localities on a daily basis? This is the quality of water today, this is the quality of water today. That automatically will bring in a lot of transparency and accountability.
At least they claim that they test the water periodically from different areas, but this data is not publicly available. If like when I went to them with this issue, they shared some test results with me from both Chungi and Sharifpura, and according to their reports the water was clean, but I don't think that the data is publicly available. But air quality data, maybe, as far as I remember, they said that the air is clean, right?
They try to, at first of course it was the air is clean,
Yeah.
but then when their own report came, it did say that it's somewhat dirty, and then they change the terminology of unhealthy to satisfactory as well. So in their submissions, they say it's satisfactory.
That's what I'm saying कि हम खांस के हमारा हाल बुरा हुआ है and they're saying that water, the air is clean. So the same thing is happening with water. That we see the health impacts of water contamination. हमारे पास data है, बहुत ज़्यादा data है. As I told you that we have collected over 1,000 samples from across Lahore, and we have like 144 coordinates मेरे पास confirmed हैं जहाँ के ऊपर contamination आई है. And I shared this data with Vasa publicly, online मैंने उनको tag करके कि see these are the coordinates. लेकिन I'm not sure कि उसके ऊपर ये भी एक बात है कि governments की priority भी ये नहीं है. So they also don't have funds.
One thing I can tell you that the environmental quality standards for water quality, air quality, these were developed by the EPA, and officially it's in the rules of business. EPA is responsible for going out and testing air quality, water quality, even they can test vehicle emissions. But then you have all these departments. So example, transport department can also go and check vehicle emissions, but they will not necessarily do anything about it. It's the EPA's job to say that this is dirty and this particular department has to clean up its act. So right now what I'm understanding is that only Vasa is actually taking samples and EPA is completely disinterested in this regard. They're not even taking those samples and testing them.
EPA also invited me for a presentation. मैं गई थी वहाँ उनके office में and I presented my work and they were super friendly. They were like they seemed interested in the work that we were doing. We shared the data with them. They have all the reports. But the idea that I have after like talking to so many people that nobody has resources to do anything. That is the problem. ये इस वक्त सबसे बड़ा मसला है climate change, environmental problems, but nobody like governments की priority नहीं है. So okay, I'm not sure whether I'm supposed to say that or not, but I went and see the EPA lab. They have all the equipments to test water samples, but they don't have like access to consumables. They don't have funds to test water. So they wanted to collaborate with us. They said that okay, we can test water samples with you, but you have to bring the kids or whatever, because they wanted to collaborate. But that's what I'm saying, that if Vasa says or EPA, they tell me that okay, we are interested in doing this kind of work, but we don't have resources, then there is another thing. फिर हम उस conversation से आगे निकल के हम government के पास demand करेंगे जी ये क्यों नहीं हो रहा. But if you will deny that the water is clean or the air is clean, तो conversation आगे कैसे बढ़ेगी? So the first step is इस चीज़ को accept करना कि there is a problem, and then we can think about it कि कैसे काम हम मिल के कर सकें इन इदारों के साथ.
No, thank you for actually saying that, because a lot of the conversations that I've been having with people, they come to the conclusion that working, because they also realize the lack of capacity, they're very willing to volunteer for the government, helping them, guide them, and we will have to sort of develop these civil society and government linkages to eventually come up with a better environment. So thank you for bringing that up, and with that I think I would like to wind up as well. I do want to do this rapid fire in the end. I'm going to throw some random words, not random, very well thought in my head to you, and then you can say whatever comes to your mind. So the number one is climate change.
Climate change. Oh my God, I'm not good at rapid fire. It's a disaster. Yeah.
Number two, smog.
Lahore.
Okay. And the Karakoram.
Floods.
Floods. That's good enough. I can tell you that most people have said something similar on those terms. Yeah. So with that, we would like to also conclude, and thank you for joining us again.